Free CNA Practice Test 2026 Realistic Exam Simulation with Answers. Question 1. The term urinary retention refers to which of the following? Option A. A normal output of urine. Option B. An inability to urinate. Option C. Incontinence or leaking of urine. Option D. A very large output of urine. The correct answer is option B. An inability to urinate. Urinary retention is the inability to completely empty the bladder, which can be a medical emergency. Question 2. Normal hearing loss in aging is usually related to the ability to hear what? Option A. High-pitched sounds. Option B. Loud sounds. Option C. All sounds equally. Option D. Rapid speech only. The correct answer is option A. High-pitched sounds. Presbycusis, or age-related hearing loss, typically affects the ability to hear higher frequencies first. Question 3. What is the best way to safely identify your patient? Option A. Asking for his name. Option B. Calling his name and waiting for a response. Option C. Checking the bed plate. Option D. Checking the name tag or identification band. The correct answer is option D. Checking the name tag or identification band. Using a formal identification tag ensures you are providing care to the correct individual. Question 4. Mrs. Jones is on a bowel training program but has not had a bowel movement for 3 days. What should you do? Option A. Report it to the charge nurse. Option B. Give the patient an enema. Option C. Offer her prune juice immediately. Option D. Increase her fluids yourself. The correct answer is option A. Report it to the charge nurse. The nursing assistant must report the status to the nurse, who will then decide on the appropriate medical intervention. Question 5. The proper medical abbreviation for before meals is what? Option A. PC. Option B. BID. Option C. AC. Option D. TID. The correct answer is option C. AC. The abbreviation AC stands for anti-sebum, meaning before meals. Question 6. What is the proper medical term for high blood pressure? Option A. Diabetes. Option B. Hypertension. Option C. Hypotension. Option D. Cerebrovascular accident. The correct answer is option B. Hypertension. Hypertension is the clinical term for blood pressure that is higher than the normal range. Question 7. A patient who has difficulty chewing or swallowing will need what type of diet? Option A. Clear liquid. Option B. Low residue. Option C. A bland. Option D. Mechanical soft. The correct answer is option D. Mechanical soft. Mechanical soft diets involve foods that are chopped, ground, or blended to make them easier to process. Question 8. To help an Alzheimer's resident feel more independent when they cannot find their room, you should do what? Option A. Scold her and tell her to stay in her room. Option B. Ask her roommate to watch her. Option C. Place a familiar object outside her room door. Option D. Write the room number on a piece of paper. The correct answer is option C. Place a familiar object outside her room door. Visual cues help residents with memory loss navigate their environment more successfully. Question 9. How often should a resident's intake and output records be totaled? Option A. Once each shift. Option B. Twice a day. Option C. Every 4 hours. Option D. Every 12 hours. The correct answer is option A. Once each shift. Totaling records at the end of each shift allows the healthcare team to monitor fluid balance throughout the day. Question 10. Which of the following should you observe and record when admitting a client? Option A. Color of the stool and amount of urine voided. Option B. How much the client has eaten and drunk. Option C. Bruises, marks, rashes, or broken skin. Option D. Insurance information. The correct answer is option C. Bruises, marks, rashes, or broken skin. Identifying pre-existing skin conditions upon admission is vital for accurate care planning and documentation. Question 11. When responding to a client on the intercom, you should do what? Option A. Ask for the client's name. Option B. Say, "What do you want?" Option C. Give your name and position and ask how you can help. Option D is say, "The nurse will answer your call." The correct answer is option C. Give your name and position and ask how you can help. Professional communication on the intercom provides reassurance and identifies the responder. Question 12. Which of the following should you do to familiarize a new client with their surroundings? Option A. Show the client where the call light is and how to work it. Option B. Tell the client not to operate the television. Option C. Ask visitors to leave while you finish admitting the client. Option D. Erase the side rails and raise the bed to the high position. The correct answer is option A. Show the client where the call light is and how to work it. Knowing how to use the call light is the most important safety information for a new resident. Question 13. When arranging a residence room, you should do all of the following except what? Option A. Check signal cords. Option B. Adjust the back and knee rests as directed. Option C. Administer medications. Option D. Check the lighting. The correct answer is option C. Administer medications. Administering medications is not within the scope of practice for a nursing assistant. Question 14. When assisting a client in and out of bed, the nursing assistant should always do what? Option A. Employ body mechanic techniques. Option B. Get another person to help regardless of the patient's size. Option C. Pull the client's feet out first and then lift the back. Option D. Put shoes on the client because they may slip. The correct answer is option A. Employ body mechanic techniques. Using proper body mechanics protects the assistant from back injuries and ensure resident safety. Question 15. How often should a resident be repositioned during an 8-hour shift to prevent pressure ulcers? Option A. Every 2 hours. Option B. Every 4 hours. Option C. Every hour. Option D. Once per day. The correct answer is option A. Every 2 hours. Standard practice is to turn or reposition residents at least every 2 hours to maintain skin integrity. Question 16. Which is the correct procedure for serving a meal to a client who must be fed? Option A. Serve the tray with all others and then come back later. Option B. Bring the tray to the client last after all others are served. Option C. Bring the tray into the room when you are ready to feed them. Option D. Have the kitchen hold the tray for 1 hour. The correct answer is option C. Bring the tray into the room when you are ready to feed them. Food should be served at the proper temperature when the staff member is available to assist immediately. Question 17. The most serious problem that wrinkles in the bedclothes can cause is what? Option A. Restlessness. Option B. Sleeplessness. Option C. Decubitus ulcers. Option D. Bleeding in shock. The correct answer is option C. Decubitus ulcers. Wrinkles create friction and uneven pressure on the skin, which can lead to tissue breakdown. Question 18. When does restorative care begin? Option A. A week after admission. Option B. As soon as possible. Option C. Whenever the patient wants. Option D. Twice a week. The correct answer is option B. As soon as possible. Rehabilitation and restoration of function should start immediately to prevent further decline. Question 19. Before changing the position of a client's bed to Fowler's position, you should do what? Option A. Open the window. Option B. Explain the procedure to the client. Option C. Check with the client's family. Option D. Remake the bed. The correct answer is option B. Explain the procedure to the client. Always inform the resident of what you are doing before moving their body or their equipment. Question 20. If you accidentally touch the inside of the sink while washing your hands, what is the next action? Option A. Allow the water to run over the hands for 2 minutes. Option B. Dry the hands and turn off the faucet with the paper towel. Option C. Repeat the wash from the beginning. Option D. Nothing, as long as you use soap. The correct answer is option C. Repeat the wash from the beginning. Touching the sink contaminates the hands, requiring a complete restart of the hand washing process. Question 21. When going on a job interview, how should you prepare to dress? Option A, wear your best jeans and a t-shirt. Option B, use a lot of perfume. Option C, wear simple, professional clothing like a dress or slacks. Option D, wear a lot of jewelry. The correct answer is option C. Wear simple, professional clothing like a dress or slacks. Professional attire demonstrates respect for the position and the facility. Question 22. Before leaving a newly admitted conscious client alone, the first action should be to do what? Option A. Ask him if he is hungry. Option B. Inspect his skin. Option C. Complete the listing of his clothing and valuables. Option D. Make sure he knows how to use the call light. The correct answer is option D. Make sure he knows how to use the call light. Safety is the priority. The resident must be able to summon help if needed. Question 23. When lifting a heavy object, the correct method would be to bend at which part of the body? Option A. The waist, keeping your legs straight. Option B. The waist, rounding your shoulders. Option C. The knees, keeping your back straight. Option D. The knees and the waist simultaneously. The correct answer is option C. The knees, keeping your back straight. Bending at the knees uses the powerful leg muscles and protects the small muscles of the back. Question 24. At what times during a shift should a nursing assistant wash their hands? Option A. Before eating. Option B. After using the bathroom. Option C. Before and after patient care. Option D. All of these are correct. The correct answer is option D. All of these are correct. Frequent hand washing is the single most important way to prevent the spread of infection. Question 25. When assisting a client with eating, one of the first things the nursing assistant should do is what? Option A. Cut the food into bite-sized pieces. Option B. Wash your hands and the client's hands. Option C. Butter the client's bread. Option D. Provide the client with privacy. The correct answer is option B. Wash your hands and the client's hands. Cleanliness before meals is essential for infection control and resident comfort. Question 26. A patient has a new cast on his right arm. What is the most important thing to observe first? Option A. A pulse above the cast. Option B. Color and hardness of the cast material. Option C. Warmth and color of the fingers. Option D. Signs of crumbling at the cast end. The correct answer is option C. Warmth and color of the fingers. Cold or blue fingers can indicate that the cast is too tight and is cutting off circulation. Question 27. Encouraging a client to take part in activities of daily living like bathing and combing hair is what? Option A. Done only when time permits. Option B. The responsibility of the family. Option C. Necessary for rehabilitation. Option D. A violation of client rights. The correct answer is option C. Necessary for rehabilitation. Promoting independence helps the resident maintain their current level of function and self-esteem. Question 28. In caring for a confused elderly man, it is important to remember to do what? Option A. Keep the bed rails up except when you are at the bedside. Option B. Close the door so he does not disturb others. Option C. Keep the room dark and quiet at all times. Option D. Remind him to shower and shave independently. The correct answer is option A. Keep the bed rails up except when you are at the bedside. Safety measures like bed rails, when ordered, help prevent falls in residents who are disoriented. Question 29. Before assisting a client into a wheelchair, the first action should be to check what? Option A. If the client is adequately covered. Option B. If the floor is slippery. Option C. If the door to the room is closed. Option D. If the wheels of the chair are locked. The correct answer is option D. If the wheels of the chair are locked. Locking the wheels prevents the chair from rolling away while the resident is trying to sit down. Question 30. You are transferring a resident with a weak left side from the bed to a wheelchair. Where should you stand? Option A. On the right side. Option B. In front of the patient. Option C. On the left side. Option D. Behind the patient. The correct answer is option C. On the left side. Standing on the weak side allows you to provide the most support if the resident's leg gives way. Question 31. While making rounds at 4 in the morning, you find a patient on the floor. What should you do first? Option A. Call 911. Option B. Perform cardiopulmonary resuscitation. Option C. Call for another nursing assistant. Option D. Assess the patient's vital signs. The correct answer is option D. Assess the patient's vital signs. Checking the resident's status allows you to provide accurate information when you call for help. Question 32. When moving a wheelchair onto an elevator, you should stay in what position? Option A. Behind the chair, pulling it toward you. Option B. Behind the chair, pushing it away from you. Option C. In front of the client to observe them. Option D. To the side and hold the door open. The correct answer is option A. Behind the chair, pulling it toward you. Backing into an elevator with a wheelchair is safer as it prevents the small front wheels from getting stuck. Question 33. The Foley bag must be kept lower than the client's bladder for what reason? Option A. So urine will not leak out and soil the bed. Option B. So urine will not return to the bladder and cause infection. Option C. So the bag will be hidden and not embarrass the client. Option D. So the client will be more comfortable in bed. The correct answer is option B. So urine will not return to the bladder and cause infection. Backflow of urine from the bag into the bladder introduces bacteria and increases the risk of urinary tract infections. Question 34. Mr. Jones is a diabetic and the kitchen has sent chocolate ice cream for his tea. What is your first action? Option A. Substitute Diet Cola for the ice cream. Option B. Hold the nourishment and report to the charge nurse. Option C. Ask the secretary to notify the kitchen of an error. Option D. Ask the other residents if they want it. The correct answer is option B. Hold the nourishment and report to the charge nurse. Nursing assistants cannot make dietary substitutions. The nurse must verify the safety of the food provided. Question 35. When assisting a client using a bedside commode, it is important to do what? Option A. Leave the call light within reach. Option B. Place toilet tissue close by. Option C. Return to check on the client periodically. Option D. All of these are correct. The correct answer is option D. All of these are correct. Safety and privacy must be balanced when a resident is using the commode. Question 36. Ensuring adequate circulation to tissues is a major factor in preventing skin breakdown. This can be accomplished by all of the following except what? Option A. Positioning the patient every 2 hours. Option B. Using mechanical aids. Option C. Giving back rubs. Option D. Performing range of motion exercises. The correct answer is option B. Using mechanical aids. Mechanical aids like lifts do not improve circulation, movement and pressure relief are required. Question 37. What is the usual purpose of cold applications? Option A. To speed the flow of blood to the area. Option B. To prevent heat exhaustion. Option C. To prevent or reduce swelling. Option D. To prevent the formation of scar tissue. The correct answer is option C. To prevent or reduce swelling. Cold constricts blood vessels, which helps limit fluid buildup and inflammation after an injury. Question 38. The hot water bottle is an example of which type of treatment? Option A. A local dry heat application. Option B. A generalized dry heat application. Option C. Local moist heat application. Option D. A generalized moist heat application. The correct answer is option A. Local dry heat application. A hot water bottle provides heat to a specific area without moisture contacting the skin. Question 39. Clients receiving an enema are usually placed in which position? Option A. On the right side. Option B. On the left side. Option C. Flat on the back. Option D. In a semi-sitting position. The correct answer is option B, on the left side. The left side lying position allows the fluid to flow naturally into the colon based on human anatomy. Question 40. A female client's perineal area should be cleansed before which specimen is collected? Option A, a 24-hour urine specimen. Option B, midstream clean catch urine specimen. Option C, pediatric routine urine specimen. Option D, a routine urine specimen. The correct answer is option B, midstream clean catch urine specimen. Cleaning the area ensures that the urine sample is not contaminated by external bacteria or skin cells. Question 41. What is the most common site for counting the pulse? Option A, the carotid artery. Option B, the femoral artery. Option C, the brachial artery. Option D, the radial artery. The correct answer is option D, the radial artery. The radial pulse at the wrist is the most accessible and common site for routine vital signs. Question 42. When counting respirations, the nursing assistant should do what? Option A, wait until after the client has exercised. Option B, not tell the patient what you are going to do. Option C, count 5 respirations and then check your watch. Option D, have the client count while you take the pulse. The correct answer is option B, not tell the patient what you are going to do. People often change their breathing patterns if they know they are being observed. Question 43. With catheterized patients, which of the following is not the nursing assistant's responsibility? Option A, inserting the catheter. Option B, preventing infection. Option C, checking to make sure it is draining properly. Option D, recording output. The correct answer is option A, inserting the catheter. Catheter insertion is a sterile procedure that must be performed by a licensed nurse. Question 44. When giving information to the charge nurse for an incident report, you should do what? Option A, write in the client's chart that an incident occurred. Option B, keep the report in your personal file. Option C, state the facts clearly. Option D, give your opinions as to the cause. The correct answer is option C, state the facts clearly. Accurate, objective reporting is necessary for the facility to investigate and prevent future incidents. Question 45. All long-term care nursing assistants must be competency evaluated and complete an educational course. These requirements are set by which act? Option A, the Omnibus Budget Reconciliation Act. Option B, the Occupational Safety and Health Administration. Option C, the Centers for Disease Control and Prevention. Option D, the Food and Drug Administration. The correct answer is option A, the Omnibus Budget Reconciliation Act. The Omnibus Budget Reconciliation Act of 1987 established national standards for nursing assistant training. Question 46. When a resident is blind, it is important not to do which of the following? Option A, leave the door completely open. Option B, rearrange the furniture. Option C, announce yourself before entering. Option D, explain the location of food on the plate. The correct answer is option B, rearrange the furniture. Keeping furniture in a consistent place allows the blind resident to navigate their room safely. Question 47. When family members visit a client, the nursing assistant should do what? Option A, ask them to stay in the day room. Option B, tell them to stay only a short while. Option C, expect them to help with care. Option D, will allow them privacy with the client. The correct answer is option D, allow them privacy with the client. Residents have the right to private visits with their loved ones. Question 48. A new resident asks you who will be there if they get sick during the night. You should say what? Option A, don't worry, you are not going to get sick. Option B, just yell and someone will hear you. Option C, ask your roommate to ring the call bell. Option D, there are people here all night to help you. The correct answer is option D, there are people here all night to help you. Providing honest reassurance helps reduce the anxiety of a new resident. Question 49. Which of the following is considered a client's right? Option A, Having curtains pulled during personal care. Option B. Having personal information kept confidential. Option C. Or receiving and sending private mail. Option D. All of these are correct. The correct answer is option D. All of these are correct. The Resident Bill of Rights protects privacy, confidentiality, and personal communication. Question 50. Mrs. Wilkes often cries while she is receiving her evening care. What should you do? Option A. Tell her to stop crying. Option B. Ignore her and continue with her care. Option C. Tell her jokes to make her laugh. Option D. Tell her it is all right to cry and you are there for her. The correct answer is option D. Tell her it is all right to cry and you are there for her. Empathy and emotional support are key components of quality care for the elderly. Question 51. When providing denture care, the nursing assistant must do what? Option A. Wash them with hot water. Option B. Hold them firmly under cool running water. Option C. Place a towel in the sink. Option D. Hold them firmly and place a towel in the sink. The correct answer is option D. Hold them firmly and place a towel in the sink. Patting the sink and using cool water protects the dentures from breaking or warping. Question 52. Sexuality in long-term care clients may include all of the following except which one? Option A. Needing private time with a partner. Option B. Caring about one's physical appearance. Option C. Engaging in public fondling. Option D. Desiring sexual interaction. The correct answer is option C. Engaging in public fondling. While sexuality is a right, public displays are generally restricted to maintain a professional environment for all residents. Question 53. Mrs. Wilkes is scheduled for a partial bed bath. This means you must wash her what? Option A. Face, neck, ears, arms, and hands. Option B. Face, underarms, hands, and buttocks. Option C. Face, hands, underarms, and legs. Option D. Face, hands, underarms, buttocks, and genitals. The correct answer is option D. Face, hands, underarms, buttocks, and genitals. A partial bath focuses on the areas that require the most frequent cleaning for hygiene and odor control. Question 54. A goal for a resident is that she not swear at the staff. When she calls you by your name instead of swearing, what is your appropriate action? Option A. Smile and give the appropriate reward. Option B. Continue whatever task is being done. Option C. Tease the resident about not swearing. Option D. Tell all of the staff that she did not swear. The correct answer is option A. Smile and give the appropriate reward. Positive reinforcement encourages the resident to continue the desired behavior. Question 55. An agitated resident must be turned every 2 hours all night. What is the first action when waking her? Option A. Turn on the light. Option B. Speak quietly and calmly. Option C. Touch her shoulder. Option D. Shout her name. The correct answer is option B. Speak quietly and calmly. Approaching an agitated resident calmly helps prevent a startle response or further escalation. Question 56. If a client objects to a certain food for religious or cultural reasons, the appropriate action would be to do what? Option A. Tell him to wait for the next meal. Option B. Offer to substitute something different for him. Option C. Call the dietitian the next day. Option D. Tell him he needs to eat what is on his tray. The correct answer is option B. Offer to substitute something different for him. Respecting dietary restrictions is part of providing person-centered care. Question 57. A client's religion forbids eating pork and bacon is being served. The most appropriate response is to do what? Option A. Encourage the client to eat it for the protein. Option B. Tell the client it is all right because the doctor ordered it. Option C. Call the kitchen for a tray without bacon. Option D. Tell the client that restrictions are not as important as health. The correct answer is option C. Call the kitchen for a tray without bacon. Healthcare workers must facilitate a resident's religious practices whenever possible. Question 58. Which type of communication can often be most powerful? Option A. A written communication. Option B. A verbal communication. Option C, silent or non-verbal communication. Option D, tactile or touch communication. The correct answer is option C, silent or non-verbal communication. Body language and facial expressions often convey more meaning than spoken words. Question 59. You tell a resident that if they do not let you wash them, they will not get lunch. This is an example of what? Option A, discipline. Option B, a verbal abuse. Option C, mental abuse. Option D, physical abuse. The correct answer is option B, verbal abuse. Threatening a resident to force compliance is considered verbal and emotional abuse. Question 60. When getting ready to make a bed, the nursing assistant should place the clean linens where? Option A, on the floor next to the bed. Option B, on the resident's overbed table. Option C, on a chair or table beside the bed. Option D, on top of the dirty linens. The correct answer is option C, on a chair or table beside the bed. Clean linen should only be placed on clean surfaces to prevent contamination. Question 61. What is the only purpose for using a physical restraint? Option A, to keep a resident from wandering. Option B, to ensure the safety of the client or others. Option C, to make it easier for staff to provide care. Option D, to punish a resident for bad behavior. The correct answer is option B, to ensure the safety of the client or others. Restraints are a safety intervention of last resort and require a physician's order. Question 62. Articles contaminated with blood or body fluids should be disposed of in which container? Option A, the regular trash can. Option B, the laundry hamper. Option C, the biohazard container. Option D, the recycling bin. The correct answer is option C, the biohazard container. Specialized containers are required for medical waste to prevent the spread of pathogens. Question 63. To avoid pulling the indwelling urethral catheter when turning a client, the tubing should be secured to what? Option A, the bed rail. Option B, the resident's upper thigh. Option C, the resident's abdomen. Option D, the foot of the bed. The correct answer is option B, the resident's upper thigh. Securing the tube to the leg prevents accidental pulling and trauma to the urethra. Question 64. When collecting a 24-hour urine sample, the nursing assistant should request that the client do what? Option A, keep the first voided urine. Option B, discard the first voided urine. Option C, only collect urine during the day. Option D, stop drinking fluids for the day. The correct answer is option B, discard the first voided urine. The collection period begins after the first void is discarded, ensuring exactly 24 hours of production is measured. Question 65. When ambulating a client, the nursing assistant should be sure the client is wearing what? Option A, no shoes at all. Option B, socks only. Option C, non-skid footwear. Option D, high-heeled shoes. The correct answer is option C, non-skid footwear. Sturdy, non-slip shoes or slippers are vital for preventing falls during walking. Question 66. Which item is the best personal protective equipment for handling infectious waste that could splash? Option A, a pair of gloves. Option B, a face shield. Option C, a cloth mask. Option D, a plastic apron. The correct answer is option B, a face shield. A face shield protects the eyes, nose, and mouth from potentially infectious splashes. Question 67. What is an appropriate response if a client expresses anger during care? Option A, to tell them to be quiet and cooperate. Option B is say, you seem upset, would you like to talk about it? Option C, leave the room immediately. Option D, tell them they are being ungrateful. The correct answer is option B. Say, you seem upset, would you like to talk about it? Acknowledging the resident's feelings helps to escalate the situation and builds trust. Question 68. You forgot needed supplies after raising the bed to working height. What should you do next? Option A. Leave the bed up and run to get the supplies. Option B. Ask the resident to watch the door while you are gone. Option C. Lower the bed and place the call light within reach. Option D. Ask another resident to find a nurse. The correct answer is option C. Lower the bed and place the call light within reach. A resident must never be left alone in a high bed because of the severe risk of falling. Question 69. A client requests that you call their spiritual advisor. What should the nursing assistant do? Option A. Tell the client you will inform the nurse of the request. Option B. Tell the client to wait until their family visits. Option C. Give the client the phone book to find the number. Option D. To explain that advisors are not allowed in the facility. The correct answer is option A. Tell the client you will inform the nurse of the request. The nurse is responsible for coordinating with spiritual leaders as part of the resident's care plan. Question 70. A client wakes up and asks for something to eat at night. What should the assistant do? Option A. Tell them the kitchen is closed. Option B. Check the client's diet before offering nourishment. Option C. Give them whatever they want from the staff fridge. Option D. Tell them they have to wait until breakfast. The correct answer is option B. Check the client's diet before offering nourishment. The assistant must ensure the snack is safe according to the resident's prescribed diet and swallowing status. Question 71. What should a nursing assistant do first before beginning to bathe a client? Option A. Shampoo the hair. Option B. Tell the client what you are going to do. Option C. Undress the client completely. Option D. Turn on the television. The correct answer is option B. Tell the client what you are going to do. Communicating before starting care is essential for informed consent and resident comfort. Question 72. When making a bed that is occupied by a client, what should the assistant do? Option A. Keep the head of the bed as high as possible. Option B. Make a toe pleat in the top covers. Option C. Use only one person to move the resident. Option D. Avoid talking to the resident. The correct answer is option B. Make a toe pleat in the top covers. A toe pleat prevents the covers from being too tight and causing pressure on the resident's feet. Question 73. Frequent turning and repositioning of the client helps to prevent which condition? Option A. Dementia. Option B. Arthritis. Option C. Pressure injuries. Option D. Heart disease. The correct answer is option C. Pressure injuries. Relieving pressure on bony prominences is the primary way to maintain skin integrity. Question 74. When applying elastic stockings to a client, it is best to position the client how? Option A. Sitting in a chair. Option B. Standing at the bedside. Option C. Lying down in bed. Option D. Walking in the hallway. The correct answer is option C. Lying down in bed. Stockings should be applied before the resident gets out of bed and their legs begin to swell. Question 75. You hear other assistants discussing how rude a client was in the dining room. What should you do? Option A. Join the conversation and share your own stories. Option B. Suggest that this is not the place to discuss the client. Option C. Record the conversation to show the nurse. Option D. Ignore them and walk away. The correct answer is option B. Suggest that this is not the place to discuss the client. Discussing residents in public areas is a violation of HIPAA and professional ethics. Question 76. The client's signaling device should always be placed where? Option A. On the overbed table. Option B. At the foot of the bed. Option C. Within the client's reach. Option D. On the floor. The correct answer is option C. Within the client's reach. The call light is the resident's safety lifeline and must be accessible at all times. Question 77. When helping a client recovering from a stroke to walk, where should the assistant be? Option A. On the client's strong side. Option B. On the client's weak side. Option C. In front of the client. Option D. Behind the client holding their waist. The correct answer is option B. On the client's weak side. Supporting the weak side provides stability and prevents falls if the resident's leg buckles. Question 78. A confused client begins to cry and scream for their parent. What should you do next? Option A. Tell them their parent is dead. Option B. Give them a sedative. Option C. Talk to them in a calm voice about familiar things. Option D. Ignore the behavior until they stop. The correct answer is option C. Talk to them in a calm voice about familiar things. Calm, supportive communication can help redirect and soothe a distressed resident. Question 79. Which action best shows respect to the spiritual needs of a client? Option A. Forcing them to attend the facility's church service. Option B. Assisting them to read their religious materials. Option C. Telling them their beliefs are wrong. Option D. Ignoring their requests for a chaplain. The correct answer is option B. Assisting them to read their religious materials. Supporting a resident's ability to practice their own faith is a requirement of quality care. Question 80. A client calls you by the name of their child who died years ago. What is your best response? Option A. Correct them and tell them you are not their child. Option B. Ask the client about their favorite memories of their child. Option C. Ignore the comment and continue care. Option D. Tell the client they are being silly. The correct answer is option B. Ask the client about their favorite memories of their child. Using validation therapy allows the resident to express their feelings without being distressed by a correction. Question 81. When providing care for a client receiving oxygen therapy, the assistant should do what? Option A. Turn off the oxygen during a bath. Option B. Check the ears for pressure points from the tubing. Option C. Encourage the resident to smoke only in their room. Option D. Clean the tubing with bleach every day. The correct answer is option B. Check the ears for pressure points from the tubing. The plastic tubing can cause skin breakdown behind the ears if it is too tight or remains in one place. Question 82. A client falls and suffers a deep cut on the forehead. What do you do next? Option A. Run to the nurse's station for help. Option B. Stay with the client and call for help. Option C. Apply a tight tourniquet around the neck. Option D. Try to lift the client back into bed. The correct answer is option B. Stay with the client and call for help. Never leave an injured resident alone. Use the call system or yell for help while staying by their side. Question 83. A client has been depressed since being admitted. What is the best thing for the assistant to do? Option A. Tell them to cheer up. Option B. Introduce the client to other clients and staff. Option C. Leave them alone until they feel better. Option D. Tell them you are too busy to talk. The correct answer is option B. Introduce the client to other clients and staff. Helping a resident socialize can reduce feelings of isolation and improve their transition to the facility. Question 84. A confused client asks what day it is. What should the nursing assistant do? Option A. Tell them to look it up themselves. Option B. Point to the date on a calendar and say the date. Option C. Tell them the wrong date to see if they notice. Option D. Ignore the question and change the subject. The correct answer is option B. Point to the date on a calendar and say the date. Using visual aids like calendars helps reorient a confused resident to their surroundings. Question 85. Which of the following is most important for the prevention of skin breakdown? Option A. Using a lot of powder on the skin. Option B. Repositioning the client every 2 hours. Option C. Keeping the room very hot. Option D. Giving the resident more pillows. The correct answer is option B. Repositioning the client every 2 hours. Turning the resident regularly ensures that no single area of the body is under constant pressure. Question 86. When caring for a client who is dying, the nursing assistant should do what? Option A. Avoid talking to the client. Option B. Pay special attention to fluid intake and mouth care. Option C. Keep the room very bright. Option D. Perform heavy exercises with the client. The correct answer is option B. Pay special attention to fluid intake and mouth care. Comfort care for the dying focuses on keeping mucous membranes moist and the body hydrated. Question 87. To best communicate with a client who has total hearing loss, what should you do? Option A. Shout as loudly as possible. Option B. Write out the information. Option C. Avoid talking to them at all. Option D is speak to them from another room. The correct answer is option B. Write out the information. Written communication ensures the resident receives information accurately when they cannot hear. Question 88. When a weak resident is positioned in a chair, where should the signaling device be? Option A. On the nurse's station. Option B. On the resident's bed. Option C. Within the client's reach. Option D. In the resident's pocket. The correct answer is option C. Within the client's reach. Safety requires that the resident can call for help regardless of where they are sitting. Question 89. How can a nursing assistant promote independence when bathing a client who had a stroke? Option A. Do everything for the client to save time. Option B. Encourage the client to do as much as possible and assist as needed. Option C. Tell the client they are too slow and take over. Option D. Make the client do everything without any help. The correct answer is option B. Encourage the client to do as much as possible and assist as needed. Encouraging self-care helps the resident regain function and maintain self-esteem. Question 90. Which method is the correct way to remove a dirty isolation gown? Option A. Pull it off over your head. Option B. Roll the gown dirty side in and away from the body. Option C. Shake the gown to get the germs off. Option D. Drop it on the floor for housekeeping. The correct answer is option B. Roll the gown dirty side in and away from the body. Rolling the gown inward traps pathogens inside and prevents them from touching your uniform. Question 91. Which healthcare team member assists the client with performing activities of daily living? Option A. The physical therapist. Option B. The occupational therapist. Option C. The respiratory therapist. Option D. The pharmacist. The correct answer is option B. The occupational therapist. Occupational therapists focus on helping residents adapt to their environment and perform daily tasks. Question 92. What does the term ambulate with assistance mean? Option A. The client can walk alone. Option B. The client can walk with the nursing assistant providing help. Option C. The client must stay in bed. Option D. The client needs a mechanical lift. The correct answer is option B. The client can walk with the nursing assistant providing help. Assisted ambulation means the resident needs physical support or supervision from a staff member. Question 93. When transferring a client, most of the client's weight should be supported by what? Option A. The nursing assistant's back. Option B. The nursing assistant's legs. Option C. The client's arms. Option D. The nursing assistant's shoulders. The correct answer is option B. The nursing assistant's legs. Using the large muscles in the legs prevents back strain and ensures a stable transfer. Question 94. When changing a soiled dressing, when should the nursing assistant wash their hands? Option A. Only at the end of the procedure. Option B. Before, during, and after the procedure. Option C. Only before starting. Option D. Hand washing is not necessary if you wear gloves. The correct answer is option B. Before, during, and after the procedure. Multiple hand washes prevent the cross-contamination of clean supplies and the environment. Question 95. A nursing assistant must wear gloves when performing which task? Option A. Helping a resident walk. Option B. Providing mouth care. Option C. Brushing a resident's hair. Option D. Feeding a resident a sandwich. The correct answer is option B. Providing mouth care. Mouth care involves contact with mucous membranes and saliva, which requires standard precautions. Question 96. When assisting a client with right-sided weakness to transfer from a wheelchair, you should support which side? Option A. The left side. Option B. The right side. Option C. Both sides equally. Option D. No support is needed. The correct answer is option B, the right side. The weak side is the most likely to buckle or fail, so it requires the most support from the assistant. Question 97. The nursing assistant can help prevent pressure injuries by doing what? Option A, keeping linens clean, dry, and wrinkle-free. Option B, using strong soaps on the skin. Option C, turning the resident once every 8 hours. Option D, limiting the resident's fluid intake. The correct answer is option A, keeping linens clean, dry, and wrinkle-free. Moisture and friction from wrinkled or dirty sheets are major contributors to skin breakdown. Question 98. If you discover a small fire in a client's room, what should you do first? Option A, run for a fire extinguisher. Option B, remove the client from any danger. Option C, close the door and walk away. Option D, call the fire department on your cell phone. The correct answer is option B, remove the client from any danger. Resident safety is the absolute first priority in any emergency situation. Question 99. When a client has memory loss or confusion, the nursing assistant should do what? Option A, give them many choices at once. Option B, give the client simple, step-by-step instructions. Option C, speak to them in a very fast voice. Option D, avoid talking to the client. The correct answer is option B, give the client simple, step-by-step instructions. Breaking tasks into small steps helps a confused resident follow directions without becoming overwhelmed. Question 100. What does the medical abbreviation ADL mean? Option A, additional daily lessons. Option B, activities of daily living. Option C, advanced dietary limits. Option D, average daily loss. The correct answer is option B, activities of daily living. Activities of daily living include basic self-care tasks like eating, bathing, and dressing. Question 101. Which action should you take to communicate with a client who has a hearing loss? Option A, efface the client when speaking. Option B, speak into the client's ear from behind. Option C, shout at the client. Option D, walk away while you are talking. The correct answer is option A, face the client when speaking. Facing the resident allows them to see your facial expressions and read your lips, which aids communication. Question 102. What is the first area of a client's body that you should wash when providing a bed bath? Option A, the feet. Option B, the perineal area. Option C, the face. Option D, the back. The correct answer is option C, the face. Washing from the cleanest area to the dirtiest prevents the spread of bacteria. Question 103. When a nurse provides you with confidential information about a client, what should you do? Option A, tell your friends about it. Option B, keep the information private. Option C, post it on social media. Option D, tell the resident's roommate. The correct answer is option B, keep the information private. Healthcare workers have a legal and ethical duty to maintain resident confidentiality. Question 104. Before entering a client's room, what should the nursing assistant do first? Option A, just walk in. Option B, knock on the door. Option C, yell hello from the hallway. Option D, wait for the resident to call you. The correct answer is option B, knock on the door. Knocking shows respect for the resident's home and privacy. Question 105. Mouth care for an unconscious client must be done how often? Option A, once per day. Option B, every 2 hours. Option C, every 12 hours. Option D, only when they wake up. The correct answer is option B, every 2 hours. Frequent care is needed to prevent infection and keep the mouth tissues from cracking. Question 106. Where should the nursing assistant place a client's soiled bedsheets? Option A, on the floor. Option B, in the soiled linen container. Option C, in the regular trash. Option D, on a clean chair. The correct answer is option B, in the soiled linen container. Proper disposal of soiled linen is essential for infection control. Question 107. Before taking the oral temperature of a client who just had a cold drink, you should wait how long? Option A, 5 minutes. Option B, 20 minutes. Option C, 1 hour. Option D, no wait is needed. The correct answer is option B, 20 minutes. Waiting 20 minutes ensures the mouth temperature has stabilized for an accurate reading. Question 108. To prevent dehydration, the nursing assistant should do what? Option A, offer fluids frequently while the client is awake. Option B, only give water at mealtimes. Option C, limit the resident to 1 glass of water a day. Option D, make the resident drink a gallon of water at once. The correct answer is option A, offer fluids frequently while the client is awake. Small, frequent offerings of fluids are the most effective way to ensure adequate hydration. Question 109. When preparing a meal tray, what is the most important action to take? Option A, check that the tray looks pretty. Option B, check that the client's name is on the tray card. Option C, taste the food to make sure it is good. Option D, add extra salt to all the food. The correct answer is option B, check that the client's name is on the tray card. Giving the wrong diet to a resident can lead to serious medical complications or choking. Question 110. Which equipment should you have available when caring for a client's beard? Option A, towel, gloves, razor, and shaving cream. Option B, a bowl of hot soup. Option C, a pair of scissors and a hairdryer. Option D, nail clippers and lotion. The correct answer is option A, towel, gloves, razor, and shaving cream. Standard shaving supplies and gloves are required for safe and hygienic beard care. Question 111. To find out what type of diet a client should receive, where should you check? Option A, in the client's care plan. Option B, ask the resident's roommate. Option C, guess based on what they like. Option D, check the newspaper. The correct answer is option A, in the client's care plan. The care plan is the official source of information for all resident needs and medical orders. Question 112. What should you do when a client with Alzheimer's disease seems depressed and quiet? Option A, ignore them. Option B, observe the client for nonverbal cues. Option C, tell them to cheer up. Option D, leave the room and lock the door. The correct answer is option B, observe the client for nonverbal cues. Residents with dementia may not be able to express their pain or sadness in words. Question 113. Which of these actions best demonstrates active listening skills? Option A, looking at your watch while the resident talks. Option B, responding when appropriate. Option C, interrupting the resident to tell your own story. Option D, walking out of the room. The correct answer is option B, responding when appropriate. Active listening involves giving the speaker your full attention and providing feedback. Question 114. The nursing assistant should understand that a back massage does what? Option A, causes the resident to become angry. Option B, promotes circulation. Option C, is only for the staff. Option D, should be done with cold water. The correct answer is option B, promotes circulation. Massages help relax the resident and stimulate blood flow to the skin and muscles. Question 115. When assisting with dressing a client with left-sided weakness, what part of a sweater is put on first? Option A, the right sleeve. Option B, the left sleeve. Option C, both sleeves at once. Option D, the collar. The correct answer is option B, the left sleeve. Always dress the weak side first to make the process easier for the resident. Question 116. A client with arthritis has trouble cutting food. What should you do to encourage independence? Option A, feed the client yourself. Option B, assist in cutting the food and encourage use of special utensils. Option C, tell the client they are not trying hard enough. Option D, take the food away. The correct answer is option B, Assist in cutting the food and encourage use of special utensils. Adaptive equipment allows residents with physical limitations to maintain their independence. Question 117. How many legs does a quad cane have? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option D, 4. A quad cane has a 4-point base that provides more stability than a standard cane. Question 118. Once a client has been pronounced dead, the responsibility of the nursing assistant is to do what? Option A, call the funeral home. Option B, make sure the body is clean. Option C, notify the distant relatives. Option D, perform an autopsy. The correct answer is option B, make sure the body is clean. Post-mortem care involves cleaning the body and preparing it for viewing by the family. Question 119. A client drinks 240 milliliters of soup, 120 milliliters of coffee, and 90 milliliters of juice. What is the total liquid intake? Option A, 400 milliliters. Option B, 450 milliliters. Option C, 500 milliliters. Option D, 550 milliliters. The correct answer is option B, 450 milliliters. Adding 240, 120, and 90 equals 450 milliliters. Question 120. What is the term for a device used to take the place of a missing body part? Option A, a bandage. Option B, an orthotic. Option C, a cast. Option D, a prosthesis. The correct answer is option D, a prosthesis. Prosthetic devices include artificial limbs, eyes, and teeth. Question 121. It is appropriate for a nursing assistant to share information about a client's status with whom? Option A, the resident's best friend. Option B, the local news. Option C, the staff on the next shift. Option D, the client's neighbor. The correct answer is option C, the staff on the next shift. Handover communication ensures continuity of care for the resident. Question 122. A nursing assistant is caring for an agitated client. What should the assistant do? Option A, shout at the client to be quiet. Option B, talk in a slow, calm, reassuring manner. Option C, restrain the client immediately. Option D, leave the client alone in the hallway. The correct answer is option B, talk in a slow, calm, reassuring manner. Calm communication is the most effective way to de-escalate agitation in a resident. Question 123. What is the purpose for padding side rails on a client's bed? Option A, to make the bed look better. Option B, to keep the resident warm. Option C, to protect the client from injury. Option D, to store the resident's remote control. The correct answer is option C, to protect the client from injury. Padding prevents the resident from hitting their limbs against the hard metal rails. Question 124. Exercises that move each muscle and joint are called what? Option A, weightlifting. Option B, range of motion. Option C, running. Option D, yoga. The correct answer is option B, range of motion. Range of motion exercises help prevent contractures and maintain joint health. Question 125. How can you best help a client who is not accepting a loss? Option A, to tell them to get over it. Option B, to encourage the client to talk. Option C, ignore the client's feelings. Option D, to tell them you are too busy to listen. The correct answer is option B, encourage the client to talk. Providing a supportive environment allows the resident to process their grief. Question 126. The Heimlich maneuver or abdominal thrusts are used for a client who has what? Option A, a broken leg. Option B, a blocked airway. Option C, a headache. Option D, a fever. The correct answer is option B, a blocked airway. This emergency procedure is used to dislodge an object from a person's windpipe. Question 127. To avoid pulling the catheter when turning a male client, the tube must be taped to which part of the body? Option A, the abdomen. Option B, the upper thigh. Option C, the foot. Option D, the bed rail. The correct answer is option B, the upper thigh. Securing the tube to the leg prevents painful pulling on the bladder and urethra. Question 128. The role of the ombudsman is to do what? Option A, perform surgeries. Option B, work with the nursing home to protect client rights. Option C, cook meals for the residents. Option D, clean the facility floors. The correct answer is option B, work with the nursing home to protect client rights. The ombudsman is an independent advocate for residents in long-term care. Question 129. A nursing assistant who is active in her church is assigned to a client with no religious group. What should she do? Option A, force the resident to join her church. Option B, respect the client's beliefs and avoid starting religious discussions. Option C, tell the resident they are going to hell. Option D, avoid the resident entirely. The correct answer is option B, respect the client's beliefs and avoid starting religious discussions. Professionalism requires respecting the resident's personal beliefs without judgment. Question 130. What should you do when a client's mail is delivered? Option A, open and read it first. Option B, give the client the unopened mail and offer help as needed. Option C, throw the mail away. Option D, leave it at the nurse's station. The correct answer is option B, give the client the unopened mail and offer help as needed. Residents have a legal right to private, unopened mail. Question 131. Which of the following is a correct measurement of urinary output? Option A, 300 pounds. Option B, 300 degrees. Option C, 300 cubic centimeters. Option D, 300 inches. The correct answer is option C, 300 cubic centimeters. Cubic centimeters are equivalent to milliliters and are used to measure fluid volume. Question 132. A client offers you a $20 bill as a thank you. What should you do? Option A, take the money and buy lunch. Option B, politely refuse the money. Option C, tell the resident it is not enough. Option D, report the resident to the police. The correct answer is option B, politely refuse the money. Healthcare workers are not permitted to accept tips or gifts from residents. Question 133. If a client is sitting in their room masturbating, what should the nursing assistant do? Option A is shout at them to stop. Option B, leave the client alone and provide privacy. Option C, call their family and tell them. Option D, report them to the police. The correct answer is option B, leave the client alone and provide privacy. Residents have a right to sexual expression in their own private space. Question 134. To convert 4 ounces of juice to milliliters, what should you multiply 4 by? Option A, a 10. Option B, 20. Option C, a 30. Option D, 40. The correct answer is option C, 30. Multiplying by 30 is the standard conversion for ounces to milliliters. Question 135. What is the normal aging process best defined as? Option A, a time when you become much smarter. Option B, the time when normal body functions and senses decline. Option C, a time when you no longer need to eat. Option D, a time when you become a child again. The correct answer is option B, the time when normal body functions and senses decline. Aging involves a gradual decrease in the physiological reserve of the body's systems. Question 136. What is the process of restoring a disabled client to the highest level of functioning possible? Option A, retirement. Option B, rehabilitation. Option C, recession. Option D, reduction. The correct answer is option B, rehabilitation. Rehabilitation programs involve many different types of therapy to help a resident recover. Question 137. Clean bed linen placed in a client's room but not used should be handled how? Option A, put back on the clean linen cart. Option B, put in the dirty linen container. Option C, saved for the next week. Option D, given to another resident. The correct answer is option B, put in the dirty linen container. Once linen enters a resident's room, it is considered contaminated and cannot be used for anyone else. Question 138. Proper use of a waist restraint requires that the nursing assistant do what? Option A, tie it as tight as possible. Option B, watch for skin irritation. Option C, leave it on for 24 hours. Option D, tie it to the side rails. The correct answer is option B, watch for skin irritation. Frequent monitoring is required to prevent skin damage or strangulation from restraints. Question 139. How many tips does a quad cane base have? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option D, 4. The 4 tips provide a wider base of support and more stability for the resident. Question 140. A safety device used to assist a dependent client from a bed to a chair is called what? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a heavy rope. The correct answer is option B, a transfer or gait belt. The belt gives the assistant a secure grip to help the resident during the transfer. Question 141. If you need to wear a gown for a client in isolation, when must you take it off? Option A, at the nurse's station. Option B, before leaving the client's room. Option C, in the cafeteria. Option D, when you get home. The correct answer is option B, before leaving the client's room. Taking the gown off in the room prevents the spread of pathogens to the rest of the facility. Question 142. What is a beginning sign of a pressure sore? Option A, a deep hole in the skin. Option B, discoloration of the skin. Option C, a large bruise. Option D, clear skin. The correct answer is option B, discoloration of the skin. Redness or a change in color that does not go away is the first sign of tissue damage. Question 143. A sudden illness from which a person is expected to recover is called what? Option A, a chronic illness. Option B, an acute illness. Option C, a terminal illness. Option D, a permanent illness. The correct answer is option B, an acute illness. Acute illnesses have a rapid onset and a relatively short duration. Question 144. An ongoing illness that is slow or gradual in onset and has no known cure is called what? Option A, an acute illness. Option B, a terminal illness. Option C, a chronic illness. Option D, a short-term illness. The correct answer is option C, a chronic illness. Chronic illnesses like heart disease or diabetes require long-term management. Question 145. Which member of the nursing team is responsible for the entire nursing staff? Option A, the certified nursing assistant. Option B, the licensed practical nurse. Option C, the director of nursing. Option D, the medical doctor. The correct answer is option C, the director of nursing. The director of nursing is the highest-ranking administrative nurse in the facility. Question 146. What is the term for an unexpected event that causes harm to a resident? Option A, an incident. Option B, a routine. Option C, an assessment. Option D, a policy. The correct answer is option A, an incident. Incidents must be documented and investigated to improve facility safety. Question 147. Which of the following describes a resident who is aware of self, place, and time? Option A, alert and oriented times 0. Option B, alert and oriented times 1. Option C, alert and oriented times 2. Option D, alert and oriented times 3. The correct answer is option D, alert and oriented times 3. Orientation to person, place, and time is a standard measure of cognitive function. Question 148. What is the term for a federal health insurance program for people aged 65 or older? Option A, Medicaid. Option B, Medicare. Option C, HMO. Option D, PPO. The correct answer is option B, Medicare. Medicare is the primary insurance provider for the elderly in the United States. Question 149. A person who helps residents voice grievances and protects their rights is called what? Option A, a doctor. Option B, a lawyer. Option C, an ombudsman. Option D, a physical therapist. The correct answer is option C, an ombudsman. The ombudsman acts as an independent advocate for individuals in long-term care. Question 150. Negligence by a professional person, such as a doctor or nurse, is called what? Option A, malpractice. Option B, slander. Option C, libel. Option D, battery. The correct answer is option A, malpractice. Malpractice is a specific type of negligence related to professional standards of care. Question 151. Making false statements orally that damage a person's reputation is called what? Option A, libel. Option B, slander. Option C, assault. Option D, neglect. The correct answer is option B, slander. Slander is the verbal form of defamation of character. Question 152. Unlawful restraint or restriction of a person's freedom of movement is called what? Option A, battery. Option B, assault. Option C, false imprisonment. Option D, fraud. The correct answer is option C, false imprisonment. Using restraints without proper authorization or medical need is a form of false imprisonment. Question 153. Touching a person's body without his or her consent is called what? Option A, assault. Option B, battery. Option C, neglect. Option D, ethics. The correct answer is option B, battery. Battery involves physical contact that is non-consensual or harmful. Question 154. Considering the whole person, including physical, social, psychological, and spiritual needs, is called what? Option A, holism. Option B, apathy. Option C, bariatrics. Option D, homeostasis. The correct answer is option A, holism. Holistic care addresses all aspects of a person's well-being, not just their physical illness. Question 155. A person who is unable to respond to stimuli is described as what? Option A, alert. Option B, confused. Option C, comatose. Option D, paranoid. The correct answer is option C, comatose. A coma is a state of deep unconsciousness where the person cannot be awakened. Question 156. The characteristics of a group of people, such as language, values, and habits, is called what? Option A, ethics. Option B, holism. Option C, culture. Option D, religion. The correct answer is option C, culture. Culture influences how a person views health, illness, and healthcare providers. Question 157. In Maslow's hierarchy of needs, which needs must be met first? Option A, self-esteem. Option B, love and belonging. Option C, safety and security. Option D, physical or physiological needs. The correct answer is option D, physical or physiological needs. Basic needs like air, water, and food are the foundation of human survival. Question 158. Restating the person's message in your own words to ensure understanding is called what? Option A, clarifying. Option B, focusing. Option C, paraphrasing. Option D, open-ended questioning. The correct answer is option C, Paraphrasing. Paraphrasing helps verify that the nursing assistant has interpreted the resident correctly. Question 159. The treatment of obesity is called what? Option A, pediatrics. Option B, geriatrics. Option C, bariatrics. Option D, obstetrics. The correct answer is option C, bariatrics. Bariatric care often involves specialized equipment for residents with high body weights. Question 160. What is the largest organ in the human body? Option A, the heart. Option B, the brain. Option C, the skin. Option D, the liver. The correct answer is option C, the skin. The skin provides protection, temperature regulation, and sensory input for the entire body. Question 161. How many bones are in the human body? Option A, 100. Option B, 206. Option C, 350. Option D, 500. The correct answer is option B, 206. The skeletal system provides the framework and support for all other body systems. Question 162. What are the two upper chambers of the heart called? Option A, the right and left ventricles. Option B, the right and left atria. Option C, the arteries and veins. Option D, the valves. The correct answer is option B, the right and left atria. The atria receive blood returning to the heart from the lungs and the rest of the body. Question 163. Which blood vessels carry blood away from the heart to the rest of the body? Option A, veins. Option B, capillaries. Option C, arteries. Option D, venules. The correct answer is option C, arteries. Arteries have thick, muscular walls to handle the high pressure of blood being pumped by the heart. Question 164. The brain and the spinal cord make up which system? Option A, the peripheral nervous system. Option B, the central nervous system. Option C, the autonomic nervous system. Option D, the skeletal system. The correct answer is option B, the central nervous system. The central nervous system is the primary control center for the entire body. Question 165. Which system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the digestive system. Option D, the integumentary system. The correct answer is option B, the sympathetic nervous system. The sympathetic nervous system prepares the body to react to stress or danger. Question 166. What should you do if a resident starts to fall while you are walking with them? Option A, try to catch them and hold them up. Option B, run to get a chair. Option C, ease the resident to the floor. Option D, scream for help and let go. The correct answer is option C, ease the resident to the floor. Easing the resident down prevents a hard impact and protects the assistant from back injury. Question 167. In the event of a fire, what does the letter R in the acronym RACE stand for? Option A, run away. Option B, ring the bell. Option C, rescue. Option D, relocate. The correct answer is option C, rescue. The priority is to rescue any residents in immediate danger from the fire. Question 168. What is the first thing you should do when finding a conscious client lying on the bathroom floor? Option A, help them up immediately. Option B, call for assistance from the nurse in charge. Option C, give them a drink of water. Option D, put a blanket over them and walk away. The correct answer is option B, call for assistance from the nurse in charge. The resident should not be moved until a nurse assesses them for internal injuries or fractures. Question 169. To be sure that a client's weight is measured accurately, when should they be weighed? Option A, at the same time of day. Option B, whenever the assistant has time. Option C, right after they eat a big meal. Option D. With their heavy winter coat on. The correct answer is option A. At the same time of day. Weighing at the same time and in similar clothing ensures that weight trends are accurate. Question 170. What is the term for the stiffening of skeletal muscles that occurs after death? Option A. Rigor mortis. Option B. Homeostasis. Option C. Peristalsis. Option D. Atrophy. The correct answer is option A. Rigor mortis. Rigor mortis begins a few hours after death and is an important consideration in post-mortem care. Question 171. Inside the lungs, where does the actual exchange of oxygen and carbon dioxide take place? Option A. The trachea. Option B. The bronchi. Option C. The alveoli. Option D. The pleura. The correct answer is option C. The alveoli. Alveoli are tiny air sacs with thin walls that allow gases to pass into the bloodstream. Question 172. What is the most common mental health disorder among the elderly population? Option A. Schizophrenia. Option B. Bipolar disorder. Option C. Depression. Option D. Paranoia. The correct answer is option C. Depression. Depression in the elderly is often underdiagnosed but is highly treatable with proper care. Question 173. Which of the following is a symptom of low blood sugar, also known as hypoglycemia? Option A. Extreme thirst. Option B. Sweet-smelling breath. Option C. Shakiness or trembling. Option D. Of frequent urination. The correct answer is option C. Shakiness or trembling. Hypoglycemia requires immediate treatment with a fast-acting source of sugar. Question 174. A prosthesis is defined as which of the following? Option A. A type of medication. Option B. An artificial limb or body part. Option C. A special type of diet. Option D. A medical insurance plan. The correct answer is option B. An artificial limb or body part. Prosthetics help residents regain function after the loss of a natural body part. Question 175. The term NPO stands for which medical instruction? Option A. New patients only. Option B. Nothing by mouth. Option C. Normal pulse only. Option D. Nighttime positioning only. The correct answer is option B. Nothing by mouth. NPO is a common order before surgery or when a resident is suffering from severe nausea. Question 176. The nurse aide is changing a resident's soiled bed linens. Where should the nurse aide place the dirty linens? Option A. On the floor next to the bed. Option B. On the bedside table. Option C. In a leak-proof laundry bag. Option D. On the chair in the room. The correct answer is option C. In a leak-proof laundry bag. Soiled linens are considered biohazards and must be placed immediately in a leak-proof bag to prevent the spread of microorganisms. Question 177. Which of the following is the best way to prevent the spreading of germs? Option A. Wearing gloves during patient care. Option B. Wearing a mask and gloves during patient care. Option C. Hand washing before and after patient care. Option D. Wearing a gown, mask and gloves while performing patient care. The correct answer is option C. Hand washing before and after patient care. Hand washing is the single most effective method for preventing the transmission of pathogens and cross-contamination in healthcare settings. Question 178. Which of the following is an example of subjective information? Option A. The patient's pain level is 7/10. Option B. The patient's temperature is 101.2. Option C. The patient's respirations are 18 bpm. Option D. The patient's blood pressure is 120/80. The correct answer is option A. The patient's pain level is 7/10. Subjective information is based on what the patient reports and cannot be independently measured by the aide. Pain is always subjective. Question 179. The nursing assistant is caring for a patient who is a two-person transfer assist. She plans on using a Hoyer lift because she is in a hurry. The assistant brings the lift into the room and the resident asks, "Are you going to get someone to help you?" What should the assistant tell the patient? Option A: "No, I am in a rush, you will be okay." Option B: "Yes, I will get another CNA to help. Your safety comes first." Option C: "Explain to the patient that you will be extremely careful." Option D: "Tell the patient you will get help, but it will take a while." The correct answer is option B. Yes, I will get another CNA to help. Your safety comes first. Facility safety protocols for mechanical lifts almost always require two staff members. The aide must prioritize the patient's safety over their own schedule. Question 180. The nursing assistant is caring for a patient who is on a bowel regimen and has not had a bowel movement in 4 days. What is the assistant's next step? Option A: report this to the nurse in charge. Option B: give the patient orange juice with Miralax. Option C: encourage the patient to drink more water. Option D: nothing, this is normal. The correct answer is option A: report this to the nurse in charge. A change in bowel habits or a lack of bowel movements for several days is a significant finding that must be reported to the licensed nurse. Question 181. The aide is caring for a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would the aide question if it arrived on the patient's tray? Option A: regular orange juice. Option B: mashed potatoes. Option C: oatmeal. Option D: applesauce. The correct answer is option A: regular orange juice. Dysphagia indicates difficulty swallowing. Thin liquids like regular orange juice are high choking risks and require thickening agents. Question 182. The patient is lying in the supine position. In what position is the patient's bed? Option A: the head of the bed is 90 degrees. Option B: the head of the bed is flat. Option C: the head of the bed is tilted backward 30 degrees. Option D: the head of the bed is 45 degrees. The correct answer is option B: the head of the bed is flat. The supine position refers to the patient lying flat on their back with the bed horizontal. Question 183. What is one reason why performing postmortem care is essential? Option A: there is no need to perform care. Option B: performing care ensures the staff feel good. Option C: one reason care is essential is that it is legally required. Option D: care is important to maintain the dignity and respect of the patient. The correct answer is option D. Care is important to maintain the dignity and respect of the patient. Postmortem care is provided to show respect for the deceased and to provide a clean and peaceful appearance for the grieving family. Question 184. The nurse aide is assisting a resident with ambulation. This patient uses a cane for ambulation. How should the nurse aide assist this patient? Option A: stand on the same side as the cane. Option B: stand on the patient's weaker side. Option C: stand behind the patient in case they fall. Option D: walk backward in front of the patient. The correct answer is option B: stand on the patient's weaker side. When assisting with ambulation, the aide should stand on the patient's affected weaker side to provide support and balance. Question 185. The aide is caring for a patient who says, "I overheard the nurse telling my roommate he has cancer. Is he going to be okay?" How should the aide respond? Option A: his condition is confidential, I cannot share information. Option B: tell your patient what type of cancer his roommate has. Option C: you should ask his nurse what is wrong with him. Option D: ask your roommate's family member about his diagnosis. The correct answer is option A: his condition is confidential, I cannot share information. Under HIPAA regulations, a nurse aide cannot disclose the medical information of one resident to another. Question 186. A resident is hitting and kicking the two CNAs who are trying to provide care. What is the next step? Option A: tie the patient's hands to the bed with towels. Option B: yell for the nurse to bring a sedative. Option C: one CNA stays in a safe place and the second CNA gets help. Option D: tell the patient they better stop hitting and kicking. The correct answer is option C: One CNA stays in a safe place and the second CNA gets help. If a resident becomes combative, the aide should ensure safety, stop care, and seek assistance from the nurse. Question 187. The nurse aide is assigned to measure a resident's urinary output from the Foley catheter. Which action is most important to prevent the spread of infection? Option A. Hold the drainage bag above the level of the bladder. Option B. Wear gloves and clean the drainage tube after use. Option C. Place the measuring container on the floor under the bed. Option D. Rinse the measuring container with cold water before use. The correct answer is option B. Wear gloves and clean the drainage tube after use. Standard precautions in cleaning the drainage port prevent the introduction of bacteria into the closed urinary system. Question 188. A client's blood pressure measure is 200/180, but they appear stable and are not in distress. What should the CNA do next? Option A. Ensure the blood pressure cuff is the correct size. Option B. Document the blood pressure and finish other vitals. Option C. Immediately notify the nursing supervisor. Option D. Tell the client their blood pressure is too high. The correct answer is option C. Immediately notify the nursing supervisor. A blood pressure of 200/180 is a hypertensive crisis. It is a medical emergency that must be reported immediately. Question 189. The CNA witnesses a resident screaming at a coworker. What should the aide do next? Option A. Yell at the resident to stop. Option B. Call the charge nurse. Option C. Apply restraints. Option D. Nothing. It is not your problem. The correct answer is option B. Call the charge nurse. Behavioral issues and verbal aggression should be reported to the charge nurse for appropriate intervention. Question 190. Bed-making technique includes eliminating wrinkles in the sheets. The CNA knows this technique assists to: Option A. Prevent pressure sores. Option B. Ensure the client is warm. Option C. Minimize the need to remake the bed. Option D. Provide improved hygiene. The correct answer is option A. Prevent pressure sores. Wrinkles in bed sheets create friction and uneven pressure, which are leading causes of skin breakdown.